Yep. Okay.
Go. Good afternoon. I'm Nancy Ross, and I want to welcome you to MOFGA's Public Policy Teach-In on Antibiotics in Livestock. First, I want to thank a few people who've made this possible. Joanne Myers, the chair of MOFGA's Public Policy Committee. Is Joanne here? Sharon Tischer, who came up with the idea for this teach-in and hosted it for close to 20 years. Heather Spalding, who is MOFGA's public policy guru and deputy director. And Diane Chavera, who is MOFGA's organic livestock expert. And while I'm thanking people who helped put together this panel, Don Honig, who's one of our speakers, was very instrumental in getting this together as well. So, round of applause to all the people who made this possible. Thank you. The other members of our panel today are Jennifer Obadia, Stephen Sears, and Alice Percy. I'll introduce them in a minute, as well as tell you what they're going to talk about. But first, a little introduction. Antibiotics are a major, or if not the major, advance of the 20th century. When I Googled antibiotics greatest invention, I got 1 million hits. Very, very important to civilization as we know it. Resistance to antibiotics, where bacteria evolve so that antibiotics no longer kill them, is a big threat to that greatest invention. We're going to hear from Stephen and Jennifer about what resistance is and what it means. The more use, the greater likelihood of resistance. Use in United States livestock for the latest year we have figures is at 29.9 billion pounds a year, or almost 80% of overall use, compared to under 8 billion pounds for human use. So you're talking 29.9 versus 8 billion pounds in humans. And another thing to keep in mind is that while human use has leveled off over the years, the use of antibiotics in livestock is increasing. It's gone up about 50% in the last 10 years alone. Now, people wanted me to say in this introduction how much of livestock antibiotic use is for non-therapeutic purposes, to promote growth or protect animals from crowded conditions. Estimates by federal agencies are that up to 4/5 of those 29.9 billion pounds are used to make animals grow bigger and faster. But we don't really know what that percentage is because Congress and the Food and Drug Administration don't have the figures and can't get the figures. No one is required to report what drugs are used or for what purposes or in which animals. The loss of antibiotics for human use because of livestock use and the lack of information about this use are big, big reasons for alarm. The Centers for Disease Control and Prevention, the American Medical Association, and the American Academy of Pediatrics, and many other public health groups have deplored this predicament and called for government action on this issue. You're going to hear a lot more in detail, and we're going to have 45 minutes for questions of these wonderful speakers that we have today. And I will introduce them one at a time and talk about what they're going to talk about and save your applause until everybody's been introduced. We're going to hear from Don Honig about the current status of animal health and antibiotic policy issues. Dr. Honig was Maine State vet for many years. His work integrated animal health, public health, and environmental stewardship. Farmers from all over Maine have enormous respect for the assistance that Dr. Honig provided to incorporate economical and successful strategies to maintain livestock health. Dr. Honig also served as an American Veterinary Medical Association Congressional Fellow in the office of Senator Susan Collins, and now serves as Chief Veterinary Advisor for the American Humane Association's Humane Heartland Program. We'll hear from Stephen Sears about human health implications and environmental issues. Dr. Sears is Chief of Staff at the Veterans Administration Maine Healthcare System at Togus. Dr. Sears most recently served as the state epidemiologist for Maine. His prior experience includes senior management positions at both Mercy Health System and Maine General Health. He received his medical degree from Dartmouth Medical School and Master of Public Health degree from Johns Hopkins School of Hygiene and Public Health. He is an infectious disease physician by training and has combined a career of both clinical and administrative medicine. Jennifer Obadia will give us national and international perspectives on science, policies, and advocacy action. She is a New England coordinator for the Healthy Food in Healthcare program of the Global Coalition Healthcare Without Harm. Dr. Obadia conducts research with Farm to Institution New England and coordinates the Massachusetts Convergence Partnership. She has years of experience in community-based education and food access programs. Her degrees are in sustainable development, conservation biology, and nutrition, with a PhD in agriculture, food, and environment from Tufts School of Nutrition Science and Policy. Alice Percy will give us an explanation and description of organic livestock production and antibiotics. And this is very hands-on as well as knowledgeable. She is eminently qualified. With her husband, Rufus, she operates MOFGA certified organic Treble Ridge Farm in Whitefield, where they grow pigs, make hay, and grow grain, vegetables, and strawberries. An advocate for organic farmers, Alice graduated from Colby College with a degree in environmental science. She's vice president of the MOFGA Board of Directors and has served on the MOFGA Public Policy Committee for many years. Each of our speakers will speak for 10 minutes, and Sharon Tischer, an able timer, will give them a 1-minute notice. So let's give them all a round of applause before we begin.
Start the clock. Thanks a lot, Nancy. I'll start mine too. It's great to be here. I'm wearing my cooperative extension hat today. I'm working part-time for a cooperative extension, and as Nancy mentioned, I also work for American Humane Association on the Farm Animal Welfare Program. I mean, antibiotics are miracle drugs. Steve's going to talk about it in humans. And one just short anecdote: about 5 years ago, I was playing soccer and I got whacked in the mouth playing, and I had a cut inside my mouth. And I drove down to New Jersey the next day to go to a concert the next day in the Meadowlands, and I woke up that following morning, like 36 hours later, with a swollen jaw, and I went to a 24-hour clinic. I developed an infection overnight, and they gave me amoxicillin, and within 8 hours I was better and went to the concert. And of course I finished the course of antibiotic, because that's what you're supposed to do, but it cured it immediately, and because it was a sensitive bacteria. So antibiotic use in farm animals, generally used to treat bacterial infections, not viral infections. For animal use, antibiotics can either be obtained over the counter, which means that you can go into Agway and buy some antibiotics, or Blue Seal feeds. You can get them by prescription from a veterinarian, or through something called a veterinary feed directive, which is similar to a prescription, but the antibiotic is in the feed, and that's very limited use. So antibiotics are used in different ways in animals to treat a disease condition such as pneumonia or a skin infection, or similar to something like my infection in my jaw when I got hit, to prevent a disease such as diarrhea in baby chicks or mastitis in dairy cows, or to control a disease such as a disease called shipping fever in beef cattle. A group of cattle are being transported and they get a disease called shipping fever, and it can be used to control that disease. The Food and Drug Administration classifies all these uses, treatment, prevention, control, as therapeutic. That's something to remember. There's another category permitted by the FDA in livestock and poultry called non-therapeutic, or some people call it production use. Antibiotics used in this manner are approved for what are called growth promotion or feed efficiency purposes and/or. Non-therapeutic use of antibiotics in feed and water is the most common in chickens raised for meat, broilers, turkeys, in swine, and in some beef feedlots. Although the exact mechanism of feed efficiency growth promotion is not entirely understood, it's thought that some of these antibiotics help boost growth in these animals by eliminating some harmful bacteria from the animal's gut. Since 1993, so for over 20 years, all antibiotics approved for use in food-producing animals have required a prescription or veterinary feed directive. The non-therapeutic uses in livestock and poultry are over the counter, so they don't require prescription. Many of those antibiotics were approved for use in the 60s and 70s, probably even further back than that, and they really haven't been looked at since. I'll speak to that in a couple minutes. In Maine, since our farmers are not heavily involved in broiler, turkey, or swine production, or in raising beef in feedlots, the use of non-therapeutic antibiotics in feed and water by Maine farmers is extremely low, if not non-existent. Other than for raising, a lot of people raise chicks in this state, and they use a coccidiostat, which is actually for a disease prevention use, so it's not even non-therapeutic use to prevent coccidiosis. Even the hen complexes over in Turner that you all know so much about, where a lot of our eggs are produced, they do not use non-therapeutic antibiotics in those hens. So antibiotic resistance, I think others will talk about this, but any time an antibiotic is used, there's a possibility that not every bacteria will be killed or rendered inactive. So a few so-called resistant bacteria will survive, and criticism of agricultural uses of antibiotics as a contributing factor in this resistance has resulted in the FDA taking very new recent steps to change its policy on the use of these drugs in livestock and poultry. Although currently, as I said, veterinarians do not have to be involved every time an antibiotic is used on a farm, that is changing with respect to non-therapeutic use. In December 2013, the FDA put in place new voluntary guidelines that will result in two significant changes in the policy surrounding non-therapeutic antibiotic use. This action is focused on medically important antibiotics, that is, those that are used to treat human disease. Okay? So number one, the FDA now considers non-therapeutic use of antibiotics in feed or water to be injudicious use. They will be phasing out the approval for all non-therapeutic uses within 3 years, from December 13th. So the clock has been ticking for almost, 9 months now, right? 26 out of 26 drug manufacturers have agreed to comply with this new policy, and the companies will either withdraw some of their drugs, and some of these drugs have already been withdrawn since December 2013. Or apply for new approvals for therapeutic use treatment, that meaning prevention, control, treatment. Remember I said therapeutic is treatment, prevention, control. Number two, the FDA will now require veterinary oversight of all these antibiotics and will be drafting new guidelines for this oversight. So remember I said that all these non-therapeutic uses in feed and water are over the counter? It's now going to require veterinary oversight, and most likely they'll be using a veterinary feed directive route for farmers to obtain these drugs. Many details to be worked out, but those are the two major changes which I consider to be, it should have happened years ago in my opinion, but my opinion didn't count too much, although I was on a task force that looked at this, American Veterinary Medical Association, about 3 or 4 years ago, and the next version of that task force met with FDA and came up with this plan, so it's kind of long overdue. So as far as avoiding antibiotic residues in food, I just wanted to talk about that a little bit, because a lot of people think, well, you know, there's antibiotics in my food, right? And well, there are not antibiotics in your food for the most part. I mean, I think with rare exceptions, we have the safest food supply in the world, even though there are some, you know, major train wrecks along the way with that, that you read about every day in the news. But our food supply is generally safe. 3 government agencies track resistance trends in people, animals, and food. The Centers for Disease Control and Prevention tracks samples from human labs. The USDA, U.S. Department of Agriculture, collects samples to monitor trends in animals, and the U.S. Food and Drug Administration monitors trends in retail meats. So we have 3 agencies overseeing this. In addition, veterinarians are required, as a provision of my license, I'm a licensed veterinarian in Maine and have been for 31 years. As a provision of my license to practice in veterinary medicine, I have to follow judicious use principles. Whenever I use, or whenever I recommend use of an antibiotic, and that includes proper storage, disposal of outdated drugs, correct administration of antibiotics, either orally, subcutaneously, intramuscularly, in the udder, etc., proper dosages, required withholding times from meat and milk, and advising farmers on correct procedures for antibiotic use. That's part of my veterinary license. So, I think is anybody going to talk about the purchasing policy? You don't want me to talk about that? I have a minute. I know. Okay. All right. Yeah. But I'll talk about it. But I have 45 seconds. Steve and I met. We're friends, and we were on a task force about 6 years ago that was appointed by the legislature to look at antibiotic use. And as a result of that, a resolve came out of the legislature that year, and there was actually a law that came out that is put in place a purchasing policy in June of 2006. So the purchasing policy says, and I'll quote it, "In soliciting bids for meat products, the Division of Purchases shall inform meat suppliers that, assuming similarity in quality, quantity, availability, and price, the state prefers to purchase products that have not been produced using medically important antibiotics for non-therapeutic purposes. The Division of Purchases shall continue to encourage school districts to take advantage of contracts awarded to suppliers whose products meet this preference." So Maine took this step 8 years ago, right? 2006, yeah. So my time's up. Thank you.
Take that away.
Man, out of breath. It's like the fastest I've ever talked.
All right, Don, that's not true. Anyway, good afternoon. Thank you all very much for inviting me. I'd like to thank MOFCA for asking me here. I'm going to be talking about the human aspects of this, and I'm sure I'm going to run out of time because I could do this for hours. First of all, I think the couple of points I want to make. Antibiotic resistance really is considered to be one of the biggest public health threats of our time. We are losing the battle against bacteria. And I'm going to talk a little about the history and how we got there, but I'm going to emphasize that in the human side, there are more and more bacteria that we can treat less and less well than we could a few years ago. Just contemplate the fact that on your body right now there are more bacteria than there are cells. And so every time you take an antibiotic or you're exposed to an antibiotic, you have the potential of actually developing resistant bacteria within you or on you. And in fact, that happens every single time. Don's face got got treated, but I can guarantee you that in his colon he had resistant bacteria because of the result of that antibiotic. And that's a fact. We're not going to get away from that, but we just have to really understand that. What I'd like to do is talk a little bit about how we got here, what that all means. If I have time during this 10 minutes, I'll talk a little bit about some of the food supply issues like resistant salmonella, which is becoming a major problem in salmonella outbreaks, and a little bit about MRSA, which is also a major problem in animals, and there's been transmission between people to livestock and back and forth. And this is what we call an inverse zoonosis. It's a disease that animals can give to us and we can give to animals, and it's actually been proven both ways. So if you look at the history of mankind, we've been trying to fight infections since basically we've been around, because people got infected, and infections cause serious problems, and they can in fact kill you. And so the Chinese actually, in 500 BC, used soybean curd, but through the centuries we tried a variety of different things. But in around 1880 or so, Koch and Pasteur, those are big names in the science of microbiology, figured out bacteria caused diseases, and they could actually see under a microscope, and they could prove that this bacteria caused this disease. And as soon as we did that, we started saying, well, if we could prove this bacteria causes this disease, then maybe we can find something to treat that bacteria. And that was what the concept of what was called the magic bullet. And there was a guy named Paul Ehrlich who actually did that around the turn of the century. And we started looking for things. And in the early part of this century, last century, the 1900s, we used metals. We used to use bismuth and arsenic, and the problem was it killed the bacteria, but it also killed us, so it wasn't a real effective strategy overall. So then it was 1929, a guy named Alexander Fleming. He actually made a mistake in his laboratory, but he looked at a petri dish because he'd contaminated it, and it was contaminated with a fungus, and he saw that this plate of Staph aureus was actually killed off by this fungus, and he realized that that fungus was producing something that killed him, and that fungus was called penicillium, and it was the mold which produced penicillin. And he was smart enough to figure that out. It wasn't really, though, until about the 40s that we started producing antibiotics in any sufficient quantity. Fortunately, it was actually produced in quantity enough that penicillin was one of the major reasons that the casualties in World War II were less than they were, because it was available for a lot of the battle wounds. And before that, people died from the simple traumas and the simple wounds overall. And I got, in case we get around to it, anybody's interested, I got pictures of Alexander Fleming. He's one of my heroes. So I bring him with him, and I actually have pictures of his plate with his fungus. Because I figured that this isn't something you get to see every day. But I'll give that to Don. Don can hold, that's the fungus. See, right there, that little blob up there, that's the petri dish, and that's the fungus. So we developed those antibiotics, but I think the important thing is that within 5 years of developing penicillin, we started seeing resistance to penicillin. And so what did we do? We made new antibiotics, okay? We found new antibiotics. We found natural products. We got tetracyclines, and then we got streptomycin, and then we got vancomycin, and then we got cephalosporins, and then we got carbapenems and quinolones and all sorts of new antibiotics. And this won't really show, but basically what we did is every single decade, all along, we got new antibiotics, we got more resistance, we got new antibiotics, we got more resistance. And so the problem is we're losing, here, Don, he's good for some. We're losing the battle. And so the strategy of finding a new antibiotic is no longer an effective strategy, because we basically found almost all that we can do, or we've created them. We now make them in the lab. We do all sorts of things. And why are we losing the battle? A lot of reasons, but this one, here, Don, this is a good one. You hold this one up, okay? This one is that we've been making antibiotics for 90 years. Bacteria have been around for 3.8 billion years. They have been figuring out ways to get around everything in the environment and everything thrown at them. And so what happens when you get treated with an antibiotic? It kills off some of the bacteria, but it doesn't kill them all. And some of them will replicate, and they'll develop some resistance to what you were treated with. And why is that? Bacteria have what's called binary fission. Means if you start with 1, they divide, there's 2, then there's 4, then there's 8, 16, 32, 64, 128, 256, 512, 1024. And I could keep going because I did that one time to amuse myself. But the reality is within 8 hours, there are over 100 million bacteria that have now grown, okay? And if they are exposed to low levels of antibiotics, they have the potential of continuing to replicate because they don't die, and they develop the potential for resistance. And that kind of happens every time we use an antibiotic. And so, as I said, when he got amoxicillin, he would have resistant antibiotics in his colon. That's what's called selective pressure. It's using antibiotics at a low level. And that's what's so unusual and concerning about using antibiotics en masse in anything, whether it's people or whether it's animals, because you're setting up that dynamic. It's how to produce resistance. I can do it in a lab. Give me some bacteria, and I just have to give them less antibiotic than it takes to kill them, and I can grow and develop resistant bugs in a very, very short period of time. And so now we have what are a bunch of names, but I'll just go over them. And this is concerning because we have MRSA, that's drugs resistant, methicillin resistant staph. We have gram-negative rods, those are things like E. coli resistant to things. We have enterococci, they're called VREs. We have the drug antibiotic resistance called Visa. We've got CREs. And CREs are what you may have heard as the new superbug. It was like it's been in the news. That's a bacteria that is basically resistant to everything that we have right now. And that's not just here, that's actually worldwide. And I hope that we will be talking a little bit about the problem, because it's not just the United States. This is an international problem. So, I'm doing real good because I'm talking almost as fast as he is. So let me switch gears for a second. So that's how we get the resistance. I want to talk just a little bit about what the ramifications and how that intersects our lives and it intersects animals. Because another big area of concern is what we call foodborne illnesses. And we have about 76 million foodborne illnesses a year, creating about 325,000 hospitalizations and 5,000 deaths. We know what causes this overall. And I say numbers like that, and you kind of go like, wow, those are big numbers. But what I think is always important, to bring it down to a real term, that means 1 in 4 Americans every year get sick with a foodborne illness. It means 1 in 1,000 people will be hospitalized. It's about $65 billion worth of cost. And the bugs that cause that are ones that we've heard. It's Salmonella, it's Shigella, it's what's called E. coli or E. coli 157 or Campylobacter. These are all bacteria you find in animals. 1 minute, oh come on. Okay, you find them in animals, and you find them in our food supply. And we know what's happened in the last decade or two is we used to we still had the problem with foodborne illness. We now have foodborne illness with resistant bacteria. And so the salmonellas are now resistant. Some of the E. coli are resistant. Makes it harder because we then treat them and we develop more resistance. And the final point that I'll go to, and if we have time we can talk about that, is MRSA, which is something we've all heard about, is now a bacteria that you can find in pigs, you can find it in your cats, you can find it in your dogs, and you clearly can find it in people, and we can find clear documented situations where we have had a pig give it to a human who then got an infection, and we've clearly seen it going both ways because we can do sophisticated genetics and say this one is from that place. And so I'll leave it with that because I'm done, and I could keep talking, as you may notice.
Excellent. Okay. Thank you so much for having me here. I'm excited that this is the topic of conversation today. So like was mentioned, I work with a group that's called Healthcare Without Harm, and we're an international organization that works with the healthcare sector on a host of different environmental health issues. And here in the United States, we have this program called Healthy Food and Healthcare, which is really working with institutions, hospitals, to increase purchasing of sustainably raised and more nutritious food. And right now our main focus is on antibiotic resistance. And really our goal as an organization, which is certainly not unique to us, is to eliminate the use of antibiotics in animal agriculture for non-therapeutic purposes. And the CDC, the Institute of Medicine, the World Health Organization, and a whole host of really big, important national and international organizations have come out with statements saying that this is a critical step if we're going to preserve the use of antibiotics for human health. And some numbers have been thrown out already, but the reason for the focus on the use of antibiotics in animal agriculture as opposed to a heavy focus on prescriptions for humans, which is also important, but the reason the focus is so largely on animal agriculture is because it is the vast majority of antibiotics that are used. So, as it was mentioned before, 80% of all antibiotics by sales are for the agricultural sector. And about 15% are for human therapy, and the remainder are miscellaneous things like antibacterial soaps and all sorts of things along those lines. I guess to give maybe a little bit of an example of something that's been, I would say, successful internationally is we all sort of turn to Denmark as the example of a country that actually has eliminated the use of antibiotics for non-therapeutic purposes. And they did it, does anyone know the exact year?
2000.
It was 2000, okay. So that happened in 2000, and it's a good case study and a good place for us to look as to whether or not this is really sort of the right road for us to be on to preserve antibiotics for humans. And some recent studies do show that in fact it has been quite successful. And so when one study looked at the percentage of staph infections that were antibiotic resistant in Denmark and compared it to the United States, and it was about 5% of the human infections in Denmark that were antibiotic resistant as opposed to about 50% here in the US. So at least on that one, which we know is sort of one of the at least more popular antibiotic resistant, if not one of the more prominent, that this is making an impact. And so the piece that I was tasked to talk about is, so what can we do about that? And so we really look at it on a couple of different fronts. We look at policies, we look at purchasing patterns, and then we look at institutions, because that's our main sort of client base that we work with. So from the policy perspective, as was mentioned, we actually have made some pretty great strides with FDA coming out with this guidance saying that these antibiotics should not be used for these growth promoting purposes and for non-therapeutic purposes. The challenge which was mentioned here is that the devil is in the details. So the language as of now is still a little bit vague, and so we're really encouraging people to be in communication with FDA, to talk to your representatives, to be in touch with FDA, and to make sure that the rulemaking around veterinary oversight is sufficient to make sure that these antibiotics are really only being used for therapeutic purposes. So that's one thing. There's also pieces of legislation right now that are in both the House and the Senate that are calling for these same types of changes in the use of antibiotics. Shelley Pingree has been a supporter of this, so good for me. And you guys have kind of been on the front line of this on a lot of different fronts with the own piece of legislation that was passed here as well. And we really do think that if those pieces of legislation come through, then certainly we'll go from suggested voluntary measures to really requiring change along these lines. So that's really sort of the pieces at the policy level. Then there's the institution and corporate level, and we've seen some good changes happening there too. I don't know if any folks have heard in the news that Purdue now has come out saying that they're not going to be using antibiotics in their hatcheries. So they're obviously a major supplier of chicken across the country, and so that's a really great step, and we're hoping that other big companies will follow suit. And I think that the reason why those sorts of corporate changes are happening is because of everyday people, and because we are starting to signal to the market that this is something that's important to us, and this is a change that we're really demanding. So when it comes to what you as an individual person can do, we've got these little cards here that I guess will be passed around at some point. vote with your wallet, right? You hear that over and over again, but it's really true. The way that you can signal to producers, to the market, to policymakers that this is important to you is to buy food, buy meat, poultry, that's been raised without non-therapeutic antibiotics or the routine use of antibiotics. And you might be wondering, how will I know? It's actually a little bit tricky. We don't have the best ways of knowing. Certainly if something is certified organic, well then you know it hasn't had any antibiotics at all, because in the organic system, if you have to treat an animal because they're sick, they're taken out of the organic certification. There's also certified humane, Maine quality trademark. I don't know that one, but that apparently can also tell you. So there's a variety of certifications, and they're all listed here. No, that's not one of them.
Not yet.
Not yet? Okay, well, it's listed here. There are a variety of certifications that you can look for that will tell you whether or not something's been raised without antibiotics. The other thing you can do is know your farmer. You know, if you're shopping at a farmer's market, if you're purchasing direct from a farmer, ask them about their practices. And if they are treating routinely with antibiotics for growth promoting purposes or something like that, tell them that you care. Ask them if it's possible for them to change. Understand what the challenges are, and I'm sure that you'll talk to sort of the, I don't know if you transition from conventional, no, always organic, okay. But you know, there certainly are challenges, there are economic impacts, but it is something that can be done. So this is one of the biggest ways that you can have an impact. Other than that, talk to your supermarket. Someone does the buying for them. Talk to the person in charge of ordering, ordering meat, and ask them if they'll start to carry a line of meat or poultry that is raised without antibiotics. Really use your voice. Talk to your representatives. Talk to the purchasers at every place where you shop and let them know that you care. And lastly, you can also talk to your policymakers. Shelley Pingree, I'm sure, could always use another voice of support, letting her know that that you're behind what she's doing, and your other representatives could certainly use some encouragement to support this legislation that is there and waiting to be taken up on the floor. So those are some things that you can do. And then, does anyone here work in a hospital or in a school or a college? Great. Is anyone a food service director? Okay, well, know your food service director. If you work in an institution, if you work in a school, in a college, if you work for government, if you work in a hospital, knock on that person's door and say, hey, this is an important issue. What can we do to serve our population meat raised without these antibiotics? And again, it's not because the food that you're eating is necessarily going to be giving you some sort of infection of the resistant strain, but it's about taking this low-grade use of antibiotics out of the system. And the only way we can do that is by shifting growing practices or production practices across the board. I think that's it on my end. Was there anything else to talk about? No? Okay, time's up.
I guess I'll begin by just giving a brief overview of what I do with my husband. Since 2005, we've been raising organic pork in Whitefield. We also do hay and grain and some produce. We're a small farm. We're on a total of about 100 acres in Whitefield and Jefferson, and we keep 4 to 6 sows and raise out 50 to 80 pigs every year. And we got into organic pork because in 2005 we looked at the MOFCA directory and said, nobody's doing organic pork. Well, people knock down the doors for organic vegetables. We'll start doing organic pork. At the time, we were one of 4 organic pork producers in the state, and I think it's about the same now. And what we found out is that a lot of people don't really have a concept of what organic means when it comes to livestock. I often get asked at farmers markets, organic pork, does that mean that you don't spray your pigs with pesticides? And I say, well, I don't. But that's sort of just the beginning. So And I think that the question, do you spray things with pesticides, is often how people approach the concept of organic agriculture, and that's not the basic concept of organic agriculture. The basic concept is that if you have a healthy system, then you will have a healthy crop, and a healthy crop does not require crutches like pesticides or synthetic medication. And much in the way that to produce a healthy organic crop begins with healthy soils and healthy conditions, the same is true for our livestock. We can't just feed organic grain and withhold synthetic medications and end up with healthy animals that will produce a crop of pork for us. So we rely on low stocking densities, high quality feed with, carefully calculated nutrition, an opportunity for the animals to express their natural behaviors. Our animals are out on pasture in the summer, and when they're in the barns in the winter, they have outdoor access and hay bedding that they can root in. And all of these things help make our animals resilient and have strong immune systems, which means that we can largely avoid those synthetic medications that are prohibited in organic agriculture. And that's extremely important to the success of our operation, because the treatments that are permitted for sick animals in organic agriculture are often not particularly effective. They're often unproven. That is one thing that modern medicine does extremely well, is treat acute illness. Sort of a holistic practice and holistic health is extremely good at preventing illness. But when an animal does get sick, I guess it's not a cut and dried issue for me when it comes to antibiotics in livestock, because when, as was mentioned earlier, when an animal does become sick in an organic system, you are expected to treat it. It's an animal welfare issue, that if you have an ill animal, you can't let it suffer to keep it organic. And so, it's not that I never use antibiotics because I'm an organic farmer. I simply have to find an alternate market for those animals. I can no longer claim that they're organic. And there are other approaches and other certification programs. We also participate in a program called Animal Welfare Approved, which also expects that you are maintaining a healthy system for your animals, and also not routinely using synthetic medication. But in their system, if an animal becomes sick and you can provide documentation that the use of antibiotics was warranted, they require you to wait twice the labeled withdrawal time before the animal goes to slaughter, but it can still be sold under their label. So I think that there's a number of approaches to the reasonable use of antibiotics and other synthetic medications in a responsible system. And I think one thing that's very important to understand is that the reliance on antibiotics to routinely prevent illness is a symptom of the American expectation for cheap food, because the regular reliance on, if you go to antibiotics first to prevent a disease problem, instead of first going to cultural controls like keeping a clean environment and stocking density and lowering stress and keeping nutrition at the top of the line, then all of those going to the medications first is the cheap way to do it. People are cutting these corners in terms of animal husbandry because that is the way to produce meat cheaply. You're packing more animals into a small building. You don't have to have the land for your hogs or your chickens to be outside. You don't have the costs of fencing to put animals out on pasture. You can use cheap byproducts for feed. And you can just sort of slap a Band-Aid over all of that with antibiotics. And then you can sell cheap pork, cheap chicken, cheap feedlot beef at the end of the day. And so when people come to me at the farmer's market and ask, I can get a boneless loin chop at the grocery store, they're on sale this week for $2 a pound, why are yours so expensive? Well, because I had to spend infinitely more on my barn space per animal. That barn cost me money. It takes us more time to do our feeding chores because our animals are spread out and on pasture, and all of that, it's amazing how much that adds up. It's not a small matter, and so voting with your wallet is very important, but it's an interesting phrase because it's not like $1 is a vote. To cast your vote for better agriculture might take more dollars than a vote for conventional ways of doing things. And I don't have an instant solution for that. I've had occasion in the last 10 years. We've certainly worked on the efficiencies in our farm system. I've watched a lot of other young organic farmers in the state trying to figure out how to make a living and still be able to offer their products to their customers at a price that not only the rich can afford. And it's something that MOFGA is working towards, helping us work towards, and that all the farmers are putting their heads together to try to figure out. But it's not an easy solution to come to. I think I'm done under my minute.
Thank you very much. We're going to have about 40 minutes for questions. And we have some handouts to tell you about that you can come and get. But first, let's give our panelists a big round of applause. People with questions, if you come up here and stand right in front and make a line. I'm being optimistic here, but Heather's going to get a microphone. And before we begin with the questions, some people have to go, so I wanted to let you know about 3 handouts we have. The little card that describes current food labeling that Jen talked about, how to raise organic livestock, either for market or for your own consumption, or both, put together by Diane Shavera, who is here now, and Organic Maine, a marketing directory of where you can get certified organic food of all kinds throughout the state. So, Heather, are you going to distribute? Maybe Diane will come help too. Okay, so those will be coming around. Questions?
I have a question that I'll direct towards Steve, but I'd be interested in hearing what other people have to say. So, there was discussion that some of the antibiotics that are used for animals are also used for humans. What is the human health effect of the antibiotics that are being used on animals that we don't use on humans? Is there a crossover effect at all?
I'm going to repeat the question, just make sure I understood it, because what you're asking, we know that if you use the same class of antibiotics in an animal, and that is related to an antibiotic in a human, that when the resistant bacteria gets from an animal to a human, then the potential for disease occurs. The question is what about the ones that aren't directly correlated with human antibiotic classes or choices overall? And the way I would answer that is that there actually are most antibiotics in animals. Some of them may not be used in humans, but they're related in some way, and the resistance. There's only so many ways that bacteria can become resistant. It can either become resistant by the bacteria not affecting its protein membranes or its genetic material, and so the mechanisms are the same. And so what happens oftentimes is that there are resistance genes that are passed from bacteria to bacteria, and although it may not be absolutely specific for a one-to-one correlation between the animal and the human, you're creating, as you create increasing resistance, the potential for those genes to pick up other resistance grows. And so even though it's not directly related, the total antibiotic exposure is going to create genetic changes within a bacteria, which, given another exposure to, clearly are going to be associated with human changes. So I think that there are theoretic arguments that because we don't use that class of antibiotics in humans, then maybe we can use those. I think that's short-sighted, and that within probably, as I said, typical time frame for resistance is a 5 to 10 year window once you get a new antibiotic or start using the antibiotic more heavily. So I'd be interested in other people's comments on that.
Yeah, sure. I mean, there are the FDA has a list of in this. If you guidance 152, I think is the FDA. You just Google guidance 152, and it'll pop up. And there's a list of medically important antibiotics in there. It's a long list, and they are actually broken down into important, highly important, and critically important. And there are antibiotics that are used in animals that are not on that list. So they're not considered to be medically important, like the coccidiostats that I mentioned in poultry. And there's a group of compounds called ionophores that are used in beef cattle, dairy cattle, and poultry that are not on that list. So they're just not considered to be medically important. So there's really, can they generate resistance in animals? Possibly, but they're not used in humans. Now, one thing I want to kind of make clear is that I favor what the FDA is doing. I favor removing non-therapeutic uses, but I have to say that this idea that there is rampant resistant bacteria moving from livestock and poultry into the human population, and then resulting in treatment failures and disease in the human population is just not true. There are small numbers of cases, very small numbers of documented cases where that has happened, but those cases are very small. The majority of the resistance issue, and this statement is right from the CDC website, is 2 million people acquire serious infections with resistant bacteria, and 23,000 die each year of antibiotic-resistant infections. And the same statement, 50% of the antibiotics prescribed to people are not needed. That probably applies to animals too. But the idea that those resistant infections are being caused by bacteria moving from the farm environment to the people environment and then causing treatment failures is just, it's not, the data is not there. Should we reduce antibiotic use in livestock and poultry? Absolutely.
Let me just add one thing on that, and I'm completely don't want to stop other questions, because I think what Don's saying is absolutely correct. But where do humans get their antibiotics? They get them from doctors, and they get them because they're generally sick and they're exposed. So that's where the resistance problem generally comes. Can it occur? The answer is absolutely yes from animals. And I think the foodborne outbreak issue is probably the easiest to understand, is because we clearly get foodborne outbreaks from bacteria that are contaminated within foods, and those are becoming resistant. So I think that what my biggest concern with all this is we're just seeing an incredible shift of all of the resistance across, call it the planet. So it's animals and humans overall.
I just wanted to add one little piece to that, maybe a caveat, and disagree with me here if I'm misunderstanding this, but there are some recent studies specific to farm workers, specifically in North Carolina, which is a huge pork production state. And there have been studies that have been finding increasingly large numbers of antibiotic-resistant bacteria actually on the farm worker body as a result from day in, day out exposure to the manure lagoons and the farm environment. So they're a population that is at higher risk for a lot of ailments and not as well protected as farm workers as other workers are by our federal legislation. And this is just another example where farm workers are again the most vulnerable.
You had a question.
Two random questions. I'm sorry I missed the whole presentation, but I was on my way over here. The first question is, I love to eat liver, and is there some fear that I should have about eating chicken livers with regard to antibiotics? That's the first question. Next one's really random because it's about spirochetes. Where do mice get the spirochetes for the Lyme disease? I know it's not part of the thing.
I can't get away from Lyme disease.
So I actually had chicken liver last night
Okay.
in Portland. And I mean, if it's cooked, I wouldn't be eating raw chicken liver.
No.
I just, although I eat raw fish. But I generally, if I eat chicken liver, I cook it pretty well.
How does that kill the antibiotic?
Well, I mean, as I think you missed part of the presentation where we talked about antibiotic residues and the fact that there are multiple layers of preventions for antibiotics ending up in our food supplies. So I don't think you have to worry about too much about antibiotics in the livers. It's just to be more worried about pathogen contamination of raw meat and that it should be cooked. Steve can talk about the spirochetes too. I mean, the mice get the spirochetes from the ticks, and
Other way around.
the tick gets it from the mouse. Okay,
so
right. So,
what
but
does the mouse get?
well, you answered that. Well, let's
Consider it.
from the tick.
Well, it becomes a. I mean, where did it come from? Okay, that's a more interesting question, which I do not know the answer of where did it first come from. But it's maintained in mice, and mice don't get sick from it. So then the ticks are. If you look at